Hey everyone, it's Nurse Dani, and each week I answer your questions with either a written response or a video, and here are answers to some of the questions that you asked during the week. If you've been trying to have a baby, the moment that you see a positive pregnancy test, you're so excited, and it doesn't take very long for you to start to dream about what it's going to be like to be a parent, or dream about what this baby is going to be like. And then it can be totally devastating if just within a few days or a few weeks you start experiencing vaginal bleeding. 20 to 40% of women experience vaginal bleeding in the first trimester, and some of these women do go on to have healthy pregnancies, but in most cases, vaginal bleeding is a sign of complication related to the pregnancy. If you've had a positive pregnancy test result and then you start bleeding, pick and call an OB provider of your choice and let them know as soon as possible that you're pregnant and bleeding. There are complications that need to be considered and looked into. These include ectopic pregnancy, miscarriage, and pelvic organ problems. If all of these complications have been ruled out and the pregnancy seems to be progressing normally, then the doctor might give the diagnosis of implantation bleeding. And again, this is a diagnosis of exclusion given only after all other complications have been ruled out. And the bleeding needs to have happened at about the right time in pregnancy, like 10 to 14 days after fertilization, or around the time when the woman would have had a missed period. So if everything adds up, everything looks good, maybe it was implantation spotting, which is benign, but again, all other complications need to be ruled out first. If your doctor determines that the vaginal bleeding is due to a complication like ectopic pregnancy, miscarriage, or pelvic organ problems, then the plan of care at that point will be based on the diagnosis. So again, if you've had bleeding, talk with your doctor and they'll be able to give you the best advice about what's going on in your situation and what can be done about it. You mentioned that you have successfully sleep trained your 6-month-old boy and you're all sleeping better now, so I'm so happy to hear that. But you have some questions. You mentioned that he still wakes up at night at least once, and you go in and check on him, and you're wondering if maybe this is encouraging that behavior. And there's a possibility that it is. But if all it requires is to go in his room and just check on him, that reassures you that he's doing okay and he doesn't have any immediate needs. It reassures him that you're there. If you can just go in and just, maybe gently touch his tummy and turn around and walk back out of the room and he goes back to sleep, then that's okay. If that's all it requires and you're okay with that, it's not a big deal. But for sure, wait at least a few minutes before going in and checking on him, because it is possible that he's learning that when he cries out, he still gets attention from you. So if he has the ability to self-soothe and go back to sleep on his own, that's best. It's best if he can do that without requiring help from you, even if it is just going in and reassuring him that you're there. Try it for a couple of nights. See how it goes. Try letting him cry for a little bit longer than you have in the past, as long as you're sure that it's not his, I need you cry. And if he stops it, well, then you'll know that maybe it was encouraging the behavior. If he continues and you're okay with getting up and checking on him, then that's totally fine. You mentioned that you have a 6-year-old son who's been sniffing a lot and clearing his throat frequently, and you're noticing a little bit of a chest rattle. You tried allergy medication because you thought maybe that was the problem, the reason behind the extra secretions, and it's not helping. I suggest calling your pediatrician and letting them know about your observations and concerns, the things you've tried, and after asking you more questions, talking with your son, and performing an exam, they'll decide if further investigation or medical attention is necessary for it. You mentioned that your 13 and 9-year-old have had a hard time sleeping since you moved into a new house a few months ago, and it can be normal for kids and adults alike to go through an adjustment phase when they're in a new environment. Moving is a big change for anyone. It kind of shakes you up a little bit, and one of the best things you can do to help you and your children transition is to keep things as familiar as possible. So if they have the same furniture that they had before, it's arranged in a similar type pattern so their bed is facing the same direction, you tell them to go to bed at the same time each night, then usually they'll fall into a new routine, their mind accepts the new surroundings as a new norm, and they're able to go back to their normal sleeping routines. Maybe examine their sleep routine and see if that's part of the problem. If they are in the same room together, maybe they're keeping each other up. Encourage them to read before bedtime. This puts a lot of people into just a very relaxed state and helps them go to sleep. And avoid excessive screen time before going to bed. So TV, electronics, they should all be turned off and put away at least an hour before bedtime. Maybe they've had a strenuous day. Maybe it's adjusting to new schedules in school. There's so many different factors that can affect sleep. So talk with them. See if you can figure out what's going on. If something's bothering them, do what you can to address it. If you don't feel like these measures are helping the situation, then talk with your pediatrician about it, because kids can actually have sleep disorders, and the doctor, after talking to them and you about it, will decide if treatment is necessary. You mentioned that you're taking Seasonique, which actually helps women have less periods. It's an oral contraceptive that takes you from having about 12 to 13 periods a year to just 4. But in between, it can cause you to have unscheduled bleeding and other side effects that might seem undesirable. And you mentioned that you're experiencing some of these, and so I do recommend calling your doctor and talking to them about your observations and concerns. And after asking you more specific questions, they'll decide if this form of birth control is the best one for you, or if there might be another that meets your needs better. You've mentioned in the past that you've had irregular cycles, you're trying to have a baby, you've been trying for 9 months, and you're not pregnant yet and wondering what the problem might be. And first and foremost, it's probably due to the fact that you've been having irregular cycles. And a normal cycle lasts about 25 to 35 days in length from the beginning of one period to the beginning of the next. And if a woman's cycles are this long, then it's safe to assume she's probably ovulating or releasing an egg that can be fertilized by sperm about mid-cycle. And then intercourse needs to be timed with ovulation in order to give the two a chance to even meet up. If your cycles have been all over the place, they're shorter than 25 days or longer than 35 days, or even if you've gone months without periods, then it's really hard to tell when or even if you're ovulating at all. So that's where you need to start. I recommend talking with a doctor, and based on their knowledge of your circumstances and history, they'll be able to determine what treatment would be best for you. Oftentimes when women are trying to conceive and they've had irregular cycles, doctors will put patients on oral contraceptives. And what this does is get your body into a habit of having regular cycles. Then after being on it for a few months, you stop taking it, your body stays regular, and you're able to ovulate and know when to time intercourse with ovulation. And most women are able to get pregnant unless there's other underlying issues. But this is a good place to start. Talk with your doctor, and again, they'll determine what the best plan is for you in order to achieve your dreams of having a baby. I hope you found these tips helpful, and if you'd like to see more, or you have questions in the future ranging from preconception to women and pediatric health, be sure to like this video, like our Facebook page, and click on the link above to subscribe to our YouTube channel.